ABC 7 News special correspondent Dr. Alok Patel is joining us live. Doctor, always great to have you. Let's start with testing. Are we seeing more cases just because there's more testing going on at this point?
Well, no, we're definitely seeing more cases because of testing, but that's not the sole reason. Now, obviously, if we have more access to testing, more people can test positive. We can also pick up more asymptomatic or pre-symptomatic cases, but that doesn't match the surge we're seeing, the increase in the positive rates of the testing in specific counties, and the increase in hospitalization. So the surge is likely not just testing, it's also community spread and the fact that the virus is still out there and people are still spreading it.
Okay, so let's talk about the community spread. We started to shelter in place 101 days ago. I can't even believe it, really. But those rules, they've been relaxing more and more over the past few weeks. We've seen more and more people outside. We hear about the businesses reopening. So is reopening leading to more cases?
Reopening is definitely a risk, and we're all thinking about it. It's hard to pin it down just to reopening because, as we've seen, different counties across California are reopening at different rates. I think part of it, you mentioned 101 days, which it feels like I was in the studio yesterday, and that was in the beginning of the year. People are getting quarantine fatigue. And so, even with or without the business reopening, contact tracers have actually placed a lot of outbreaks to birthday parties and graduation parties, gatherings. And so, we're actually seeing a combination of both people being a little bit more relaxed with the safety guidelines and all these businesses which are reopening, which makes me nervous about all the businesses you listed earlier that are about to reopen here.
Yeah, absolutely. Come Monday. And, I think people were already feeling the fatigue of shelter in place a month ago. I mean, we saw Memorial Day. A lot of people started to head outside, and a lot of people were worried that that would cause a spike in the cases. Was that one of the culprits?
So that was associated with a spike in cases, but again, the spike we're seeing right now is more associated to the past week or so. But again, like I mentioned, contact tracers, even back then, 2 weeks ago, were pinning outbreaks to barbecues, gatherings. That was around the time also of graduation parties, people heading to crowded beaches. I think a lot of Californians were tired of it. Now, one thing that we worry about is with the national message about the virus slowing down and businesses reopening, some people have a false sense of hope. And they may think, you know what, we're out of the woods right now. We can get a little bit more relaxed about things, but that's absolutely not the case. And there was another statistic that was glaring showing that more young people were testing positive, which might be the same crowd who's going out to those gatherings, those barbecues, and maybe going to the nail salons and the outdoor bars pretty soon.
Yeah, and it's not all just fun. We're seeing a lot of social movements. I mean, George Floyd, he was killed on Memorial Day, and his death led to those massive protests across the country. We saw so many right here in the Bay Area. You saw lots of people out in the streets, some with masks, some not, but they were all gathered so closely together. A lot of people, if you look on social media, will say, well, the protests, that's what caused this huge spike. How did that play into it, doctor?
As of right now, we don't have evidence that the protests caused the huge spike we're seeing. And there's multiple factors that could be into play. One of them is it's still early and there's an incubation period, and there may still be a downstream effect from the protests. But also, there was early data and modeling showing that during the protests, more people are actually staying home during the protests because of the curfew and the mandates, and a lot of businesses were closed as well. That may have augmented some of what the risk was with a lot of people being together. Also, people are outdoors. That may have played into it also. But right now, we're not seeing the link that some people were afraid of. And it goes without saying, and I have to throw this in, that we really do stand by the public health cause of those protests. And so I'm glad that we got both messages out there to fight the pandemic and to fight systemic racism.
All right, sound good. Well, I love having you because you're like our in-house, well, sort of in-house, now at your house, fact checker for us on all these medical questions we have, because we can set the record straight now. Thank you, doctor. We appreciate your time.